Hi, thank you for joining us for this year's virtual Benefits Open Enrollment presentation. My name is Jamie, and I'm the Director of Risk Management and Insurance here at CFISD. I'd like to introduce the rest of our staff that's here to assist you with any questions you have. First, we have Angela.
Hello, I'm Angela, Assistant Director of Risk Management and Insurance. I will be the one speaking during the presentation following this message.
Hi, I'm Laura, and I'm your benefits specialist if your last name begins with A through K.
Hi, I'm Robin, and I'm your benefits specialist if your last name begins with L through Z.
Hi, I'm Debbie. I'm the Workers' Compensation Specialist. I'm also trained to answer benefit questions when Robin and Laura are busy helping other employees.
Hello, I'm Angelina, and I handle the district's insurance billing.
Hello, and welcome to the 2020-2021 Cypress-ISD Benefits Open Enrollment presentation. Open enrollment will be July 20th through August 14th, 2020, and the plan year will be September 1st through August 31st, 2021. The agenda for this meeting will consist of going over TRS ActiveCare and the Affordable Care Act, the Insurance Department website, exactly what TRS ActiveCare is, what's new with TRS ActiveCare this year, the medical plan and options, Caremark prescription drugs, premium rates, as well as cost comparisons. One of the important things of open enrollment is either enrolling in the medical insurance or waiving. This will be the 6th year the Affordable Care Act is requiring providers and employers to submit Form 1095-C to the IRS and Form 1095-C to the employees for the 2020 calendar. Employers are required to offer health insurance to eligible employees and collect declination forms from employees that choose not to enroll in order to satisfy reporting requirements and avoid penalties. Employees failing to decline may not be allowed to enroll later should they experience a special enrollment event. It is imperative that you log into the First Financial Benefit System and either enroll or waive a medical plan. This is an example of our insurance website. You will reach this website by going to cfisd.net, staff, HR, and then insurance. Once you're on the insurance website, you will see a host of information for you to make your benefit selections. One area that you may want to consider looking at is your benefit station. It goes into depth with the benefit plan summaries, plan designs, networks, and it just has each of our benefits broken down, whether it's medical, dental, vision, cancer, or whatever you may need. So what is TRS ActiveCare? It's a statewide healthcare benefits program for employees of school districts, charter school, regional educational service centers, and other educational districts. It was established into law in 2001 by the Texas legislature, and today it consists of 90% of Texas school districts in participation. The law also authorizes minimum funding levels to help employees pay for the coverage. This is the $225 district contribution that normally employees will ask, well, what is the district contributing? Cypress-ISD joined TRS ActiveCare September 1st, 2011 for the 2011-2012 plan year. And the current law is once a district joins TRS ActiveCare, they cannot leave. We get the question often, well, can Cypher leave and go independent? But it is law that we cannot leave once we have joined TRS ActiveCare. So now we'll talk about what's new for TRS ActiveCare effective September 1st. Blue Cross Blue Shield will be the new carrier effective September 1st, 2020. Primary Plus will replace the Select plan, and there's also a primary plan that is new. It's a state plan. All tiers of Primary Plus, which was Select previously, have a decrease in premiums. That includes employee, employee and child, employee and spouse, and employee and family. There's a decrease in those premiums. ActiveCare HD, employee and child, and employee and family premiums also have a decrease for this plan year. There is one thing that each person needs to take in consideration if they're doing primary or primary plus that you will need. It does require a PCP. When you enroll, you will have to select a PCP before you move forward on this plan. Eligibility to enroll. To be eligible for TRS ActiveCare coverage, you must be employed by a participating district entity and be an active contributing TRS member, or if you're a substitute or temporary worker, you be expected to work 10 or more hours a week to enroll in the TRS ActiveCare plans. Employees that would not be eligible for TRS ActiveCare are state Texas employees or TRS retirees receiving or have declined coverage under TRS care. The eligible dependents here at Cyfair are the spouse, which also includes common law spouse and same-sex marriage, children, whether they are married or unmarried under the age of 26, which includes natural children, adopted, stepchildren, foster children, or if you have legal guardianship, that child would be covered as well. Other eligible dependents that would be case by case would be those such as grandchildren or a disabled child of any age that still needs care. Please just reach out to your benefits specialist if you need additional information on if a dependent can be deemed eligible for benefits. There are certain special eligibility situations here at Cyfair. If an employee and spouse both work for a participating district, the spouse may be covered as an employee or as a dependent of an employee. And keep in mind that only one parent can cover dependent children. For a child that is under 26 employed by a district and is contributing to TRS, they too can be covered as a dependent on his or her parents' TRS ActiveCare coverage. Now, this is a change from 2 years ago where previously, if you were a TRS contributing member and you were under 26, your parents could not cover you. But due to the Affordable Care Act, with allowing 26-year-olds or under to remain on their parents' plans, you now can cover your child. This chart is a summary of enrollment for this past current fiscal year, plan year for our plans as of May 2020. There are a total of 15,800 benefits eligible employees here at Cyfair. Of the 15,800 employees, approximately 8,400 actually take on the medical. Around 6,000, which is about 71%, have been on ActiveCare 1 HD. We've had 22% on ActiveCare Select and 7% on ActiveCare 2. Now that we have the primary and primary plus plans, we're anticipating that some employees will either migrate away from ActiveCare 2 to the primary plan or migrate to HD. And also, this graph depicts that 53% of our employees do take on the insurance here at Cyfair ISD. This chart is a monthly premium for employees. It just gives a breakdown showing for full-time employees, the lowest premium for the primary plan is $161, and it also shows that the most expensive would be if someone was on ActiveCare 2 and chose the employee family plan at $2,133 each month. This is the employee-only premium and plan comparison. This shows the annual premiums that an employee will pay before they even step foot inside of a doctor or facility or a hospital or need a procedure. The annual premium on the primary plan is $1,932 versus if you were on ActiveCare 2, you would pay $8,388 before you even have a medical need. That's something that you want to take into consideration when you're trying to evaluate which medical plan you should adhere to. The deductibles range from $1,000 to $2,500. The coinsurance is 80-20. The primary plan has a 70-30 split, which we'll discuss later on in this presentation. This is the same chart, but it's the family comparison. A family on primary plan would spend $9,852 in the beginning, and they could spend up to $25,596 if they run ActiveCare 2 plan. So once again, you need to look at the annual premiums that will come out of your check versus the deductibles that are on the plans, the coinsurance, and of course the out-of-pocket maximum is what you would have to pay before you're at 100% covered. Now, since we've talked about coinsurance and co-payments, there are individuals that may need a better understanding of what these terms mean. So what is a deductible? A deductible is a fixed dollar amount, such as the $2,800 on the HD plan, and it's of the eligible expenses you are required to pay before your insurance either reimburses you or pays your medical provider directly for a covered service. Coinsurance is your share of the cost, example 20% of the covered health care service, usually a percentage of an eligible expense due after you have met your annual deductible. And finally, a copayment. It is a fixed dollar amount, example $30 copay that you may pay at an office visit that you're required to pay for a covered service at the time you receive care. So now that we've discussed the terminology of medical, here's just a oversight on the plan overview. This shows for primary, HD, primary plus, and ActiveCare 2, the deductible range, the out-of-pockets, the coinsurance, and the copays. As you can see, there's an individual deductible for each plan, and then there's a family deductible for each plan. And one thing I will say at this time is previously on the HD plan, you had to meet a family deductible before that 80/20 kicked in. This is a big change that they're doing this year where an individual just needs to meet the $2,800 and then they go to 80/20. If you're on the HD plan, you do not have to reach $5,600 before the 80/20 starts for one person. That's a big improvement for this plan year. The coinsurance is 20% on all the plans except the primary. It has 30%. And you may ask, what's the main difference between primary and primary plus? They're both statewide plans, which is an improvement because previously the select plan, it was you either had to go to Kelsey-Seybold or you had to go to Memorial Hermann. So now it's a statewide plan. But on the primary plan, you're going to pay less monthly on your premium, but your coinsurance is high. So you kind of have to outweigh how much you want to pay with your deductibles if you're trying to decide between primary and primary plus. And I also want to encourage each of you to please use your preventative care benefit. It pays 100% when you're using your network providers. So make sure that your children are getting their well visits with their shots. You yourself can have your annual exam. If you're a female, you can have your well woman, and these are preventative care covered at 100%. These are some other overviews on your medical, your CAT scans, your inpatient, emergency, and outpatient costs. On this slide, I just want to encourage you, when you're getting CT scans or MRIs, it is always cheaper to go to a facility that does that. They specialize in it. It's going to be cheaper to go there than if you were to go and use a CAT scan or CT in a hospital. And as a consumer, you need to treat your benefits just like you treat your car. You're searching for the best deal for your money. Different facilities have different costs. CTs and MRIs, they tend to be expensive. So definitely do your research if you need that. I will caution you against the freestanding emergency rooms. Do your diligence and make sure you're going to an urgent care over a place that says emergency room because they bill much higher and it will hit your pocket and it will hit the state's pocket. So if you think you've sprained an arm or if you think you have the flu, you want to try to shift to an urgent care if you can't get to your doctor. You don't want to rush to the ER because that's going to cost you more money over time. This chart shows an example of the prescription drug benefits, the deductibles for the benefits, your tiers, whether it's generic, preferred, non-preferred, and it also shows the cost of your mail order. You typically want to stick with generic. It's going to cost you less, and you're going to get the same benefit with the drugs. Some people have special cases where a generic just does not work with their body, and in that case, you do want to do a preferred or a specialty drug. There are also maintenance drugs, and the maintenance medications are if you're long-term, if you have high blood pressure or diabetes, and you need to maintain your health, that is what a maintenance medication is. And it's wise to do a 90-day supply on those as opposed to refilling every 31 days. It's more beneficial. It costs less for you to do it over 3 months as opposed to every 31 days. And this slide just shows you how you can access Caremark. You can go to caremark.com/TRS ActiveCare, and you can see plan options. You can get an idea of how much the drugs will cost you. You can also request a temporary ID card. Now we're going to discuss ways to lower your prescription drugs. For this plan year, they've added primary to ActiveCare HD, where you can receive certain preventative generic drugs at no cost. TRS waives the deductible and coinsurance under these two plans for these drugs, and the list of the drugs is posted on Caremark website for you to review if one of your drugs is on this list. When you're on a maintenance drug, it saves you, as we stated in the previous slide, if you do a 90-day supply rather than a 31-day supply 3 times. And also, if you're not comfortable or you don't want to get your medication in the mail, you can also do a Retail Plus pharmacy. And I will advise you that the only Retail Plus pharmacy for a 90-day supply that you do not want to go to is Walgreens. They will not give you the 90-day supply. As always, try to use the generic drugs when it's available. And also, if you're diabetic, you are eligible for the preferred diabetic meter at no cost. And they also have a diabetic meter team to assist you with questions and guidance, and that number is on this slide. For this plan year, everyone will receive a new medical ID card, whether you're on HD, Primary, Primary Plus, ActiveCare 2, or even the HMO plan. You'll receive a new card. We have a new carrier, Blue Cross Blue Shield. The HD and the ActiveCare 2 are family ID cards and only have the subscriber's name. And the subscriber means the employee here at Cyfair. Their name will be on those cards. Now, if you choose to enroll in Primary or Primary Plus, those ID cards will be issued to each member of your family, and that's because the PCP, which is the primary care provider, their name is going to be on that card. So that's why each person will have their own card if you're on Primary or Primary Plus. You will also be mailed a Caremark prescription drug for your pharmacy needs. If you need additional cards, or if you have a larger family, you're going to get 2 cards per family. But if you have a larger family and you have a student away at college and you need additional cards, just call customer service and they will assist you with that. And the HMO plan will also receive individual covered plan cards. For additional enrollment support, you can go to bluecrossblueshield.com/TRS ActiveCare. And on this website, you can see plan overview, highlights. If you want to locate a doctor or hospital, that is there for you. There's also a Emma benefits counselor that's virtual that assists you. And your prescription drug benefits are also on this website. The number for TRS ActiveCare, since we're not going to Blue Cross Blue Shield, there is a change in the customer service number you've used the past few years. The new number is going to be 1-866-355-5999. And their customer service can assist you with claim questions, provider information, eligibility, and also if you want to call and request a card, they can assist you with that as well. Split premiums are offered when 2 employees, say you're here and you have a spouse at Klein ISD. As long as you both have TRS ActiveCare at your district, you can enroll in a split premium. One person will enroll yourself and your spouse or your family, and the other person at the other district will decline. That is very important that one enrolls and the other waives. Keep in mind that different districts have different district contribution, so what you may pay here at Cyfair may not be the same what your spouse pays. So look at if doing a split premium will be advantageous to your family. If you would like additional information or if you choose to split, please contact your benefits specialist and we will help you, as that is a manual process. New this year, we have Ask Emma. Ask Emma will replace what you may have been familiar with, Alex. Emma is a new virtual assistant, and she will help you select the best plan based on age, gender, address, plan details, and costs. Emma also evaluates expected doctor visits and current prescription drug usage. Another tool that can help you day to day is an app. Currently, most of us have the TRS app that rolled out last year, but effective September 1st, you'll be able to download the Blue Cross Blue Shield app. And this can be helpful if you're just out and about and you want to locate a doctor, or if you feel ill, you need to find an urgent care. The app will assist you with that. The app will also let you see your claims, and you can look at your card. If you don't have your medical ID card with you, it'll be loaded on the app. Virtual health is something that saves us time. In this day and age, we're working, you may be shuffling your kids around. So virtual health, it allows you to see a doctor wherever you are. On the TRS ActiveCare, you can see board-certified doctors via telemedicine. The copay is waived on the ActiveCare Primary Plus, and ActiveCare 2 plans. If you're on the HD plan, there is a $30 consultation fee for telehealth. The good thing is you'd rather spend the $30 using virtual health as opposed to a sick visit or going to the urgent care, which could run you almost $100 on the HD plan. So keep in mind, if you're sick, you may want to reach out to one of these methods. They can diagnose infections, bronchitis, flu, and the common cold, and they can do it whether you're at home or your work traveling. This is beneficial for some teachers where if they're having their lunch and they don't want to leave but they're not feeling well, they can call and set up an appointment, and you can schedule it or they can just call you back. Generally, the guaranteed callback is 60 minutes, but from personal experience, usually they can call you back within 10 minutes. Most of you are familiar with Teledoc. That's what the contract has been with TRS ActiveCare, but effective September 1st, we now have ReadyMed, and you can choose either one. We have had ReadyMed with our workers' compensation, and our employees have enjoyed using ReadyMed, so we're happy that both of these virtual health options are now going to be available to the district, and that's going to be effective September 1st. Now we'll discuss some of the COVID resources for TRS ActiveCare because that is a major concern for most of us in society at this moment. Currently, TRS ActiveCare is waiving the cost of diagnostic testing. They're waiving inpatient coverage for treatment, and for your delivery prescriptions, those are free currently. They're allowing early refills for maintenance medications, and they also have a crisis line. And there's more information on what TRS ActiveCare is doing if you go to the website. The TRS ActiveCare website will give you further resources on dealing with protecting your family and what TRS is doing with COVID-19. For the benefit enrollment, I just want to remind you, please make sure you log in. It is a passive enrollment this year, meaning if you do not log in, whatever you have now will roll to the new plan year. But if you want to make changes, we do encourage you to log in and make your selections. Of course, the open enrollment period is going to start Monday, July 20th and extend to Friday, August 14th at 11:59 p.m. Please make sure that you do make your selections by August 14th, 11:59 p.m. We cannot adjust or allow you to go in because you forgot or you had, technical issues. We really want you to go in and make your selections early on because you never know what personal issue you may have that arises. Mid-year plan changes, if you incur one of those, marriage, birth, death, adoption, make sure you do that event. You only can do it within 31 days of the event date. And if you have further questions about the midlife changes, that is on the insurance website. For our new hires, welcome to Cypher ISD. You have 31 days from your first day of employment. Now, some employees, just to clarify, you may have signed your contract in June or July, but we're basing the countdown on the date of your contract that actually begins. For this year, most of the new teachers, your hire date is August the 10th. So you have until Wednesday, September 9th to make your enrollment. And another example is the 31 days, say you're hired in January 8th of 2021, you have until February 7th to make those decisions. And once again, you'll go staff, HR, insurance, and you'll do your online enrollment system there. I touched on mid-year plan changes a couple slides, but this is just a reminder that you have 31 days from the event. And if you do not make your selection within those 31 days, you will not be able to enroll in benefits until the next open enrollment. And keep in mind that our open enrollment is typically in the summer months with a start date of September. Here at Cypher, we also have optional benefit plans for you to choose from. We have a health savings account, we have life insurance, we have disability, dental plans, we have vision, cancer and specified disease, and this year we also have a new identity protection benefit, and there's also long-term care insurance through Genworth, and that's through actual TRS. Now I'll go into each of those optional plans. The first one is the health savings account. A HSA is a special account owned by an individual used to pay out-of-pocket expenses such as deductibles or to grow savings for future qualified expenses. It is purely funded by the employee. There's no district contribution at Cypher for the HSA plan. It is a pre-tax payroll deduction, and the maximum contribution that you can make if you're an individual on the HD plan is $3,550 for the 2020 tax year. If you're on a family family plan, your maximum will be $7,100 per family. If you're 55 years of age of over, you do get the additional $1,000 catch-up per year. And it is portable, meaning that if you decide you're on HG this year and next year you go to the select plan, whatever contributions you have made to HSA, that will always be your money. If you leave HSA, that money is yours in that account. The eligibility, you must be on a high deductible plan to have an HSA. And at Cypher, the only plan that we have is the TRS ActiveCare HD plan, and that allows you to have an HSA. You cannot be enrolled in Medicare if you're going to have an HSA plan. One other thing I want to point out is that there is a maintenance fee of $2.50 per month, and that is paid by the employee to have an HSA account. The next optional plan is our optional life and AD&D insurance. The district gives each benefits eligible employee $30,000 towards their basic life, district paid. If you're 65 to 69, it does drop to $19,500, and if you're 70 years or older, it does drop to $15,000, but that is district paid. If you would like additional optional life insurance, it does go up to $500,000. There is a guaranteed issue of $250,000 for new hires. So I always encourage new hires, when you enroll, when you first start at the district, and you think you would like $250,000, this is the best time to do it because it's guaranteed issue. There's no evidence of insurability. There's no health care questions. So it's the best time to get that $250,000. For a spouse, it goes up to $125,000, and the guaranteed issue for your spouse without any health questions for new hires is $50,000. Optional child life, each of your children, whether you have 1 or 10, it's going to be $10,000 for each of your children. And in order to have the $10,000, you do have to have at least $10,000 employee optional life. And that will be the same for the spouse. Your spouse can't have $50,000 if you just have $20,000. It has to at least be the minimum of what you have. This plan is administered by Voya Financial, and if you have additional questions, you can contact Tammy with Kano's Partners. The next plan that we have at Cypher is the disability insurance. This plan provides a maximum benefit of 66.7% of your monthly earnings, up to $7,500 if you are disabled or unable to work. There is an elimination period that you can review to decide if you want to wait 7 days, 14 days, or 30 days on this plan. It is structured into 2 entities. Plan A, it pays for disability, injury, or illness to the age of 65. Plan B pays for disability, illness up to 5 years. Injury does go to age 65. It is another guaranteed issue policy with no health questions. This plan is administered by Sun Life, and you can contact Audrey Ayers with Station and Ayers for additional information about disability. Dental insurance is our next option. We have Cigna Dental PPO. This dental plan allows you to choose which dental provider you want to go to. Cigna also offers a DHMO plan where you do have to select the doctor or the dentist that you would like to go to at the point of enrollment. There's also a co-payment schedule for the DHMO plan. This plan is administered by Cigna Dental, and Audrey will be your contact if you have additional questions. We also have 2 discount plans with dental. We have MS of Dental. You receive discount on dental services, and Wes Ryan will be your contact person for this plan. There's also the QCD of America, which is also a discount plan, and you will contact Member Services if you have any additional questions on this plan. Up next, we have our vision insurance. Vision provides coverage for regular eye exams, lenses, and frames. It includes coverage for single vision, bifocal, trifocal, lenticular, and medically necessary contact lens. Previously, you had a frame allowance of every other year. This year, we've added, if you would prefer to have frames every year, there's now a Plan B. The vision is administered by Guardian VSP Vision, and Reginald Lilly is our agent for this, and you may contact him for additional questions with this plan. There is also cancer and specified disease offered at Cypher ISD. This plan pays cash benefits to the covered member when services are received for the treatment of cancer or disease specifically named in the policy. It includes an annual wellness benefit up to $100 for cancer screenings. There is a health questionnaire that must be submitted to pass eligibility. And if you have questions about the structure, the ICU, the plans of this, you can reach out to Lou Moore, and this plan is administered by Humana. Something new, we now have identity protection. It's going to be a district-paid benefit for the basic level employee-only plan. And you have to opt into this if you would like this protection. You can also do different tiers if you want to enhance the identity protection, but it is protection at your fingertips with cyber alert protection. There's credit bureauing, there's lost wallet protection. It is administered by iLock 360, and their customer service number is provided below. One of our final benefits offered at Cypher ISD is tax-deferred retirement investment plans. You can choose between a 403B or 457. They both are administered by TCG. You can start any of these any point during the year. It's not something that you have to elect during open enrollment. I will say that the 457 plan, it is built into our platform, so you can do it while you're selecting your other benefits. Otherwise, during the year, you do have to reach out to TCG to enroll in these plans. Long-term care is something that's offered through TRS, Teachers Retirement System. If you would like additional information on this plan, you will have to go to the TRS website to get information on long-term care. So finally, I just want to give you some contacts. If your last name is A through K, please contact Laura Unger at 281-897-4138. Her email is also listed. If your last name is L through Z, please contact Robin Rubalcava at 281-897-4747, and her email is also listed on this slide. If you're having technical questions, not necessarily a benefit question, you can contact First Financial Benefits Online Enrollment System. They have a customer service that will guide you through, or if you just need help clicking, you're not sure where to click, they're there for technical support and assistance. Their number is 855-523-8422, and they are available Monday through Friday, 8 a.m. to 5 p.m. In conclusion, we thank you for tuning in and listening to our presentation this year. We hope you enjoyed it. If you need additional assistance, we are here Monday through Friday, typically 7:30 to 4:30. TRS ActiveCare Blue Cross Blue Shield is also there for your assistance. If you have further questions or high-level questions, they're there to assist you. Once again, open enrollment for this year begins Monday, July 20th, and it ends Friday, August the 14th, 2020, and the plan year will be effective September 1st, 2020. And finally, since the plan year does start September 1st, we encourage you to please look at your check on September 15th to ensure that what you enrolled is what is on your check. If you have any discrepancies or questions, that is the time to please contact the insurance department so we can research your issue. We thank you, and we hope you and your family have a safe and successful 2020-2021 benefit plan year. Thank you.
We hope you found this presentation helpful and informative. If you have any questions, please email or call our office. Thank you.